Hello and welcome to The Public's Health, the show that puts you, the public, into public health. I'm your host, Dr. Muntu Davis, Health Officer of Alameda County, and here's what's coming up in this episode. In the Public Health Department, we believe that preparing for emergencies is an ongoing process. In my interview with Dominic Moreno, Strategic National Stockpile Coordinator, you'll learn about local plans for storing and distributing emergency medicine. He'll also discuss our collaboration with BART to provide H1N1 vaccines inside the 12th Street BART station. Later, our Public Health Nursing Division takes the stage, or should I say the screen. You'll see a short movie about the division, followed by an interview with the Acting Director of Nursing, Angela Ball. If you're a fan of retro television, you won't want to miss this movie. A major health problem for America's children is being overweight or obese. In our Caring About Your Health segment, Karen Owoc interviews a health department nutrition expert with a unique specialty. She trains pediatricians on how to advise children about obesity during their doctor visit. The technique is called brief focused advice and only takes 3 minutes or less. Speaking of children, first up on the show is Leslie Ludwig to tell us about the Owoc Germs project, which teaches young children proper hand washing techniques. Take it away, Leslie.
The Owoc Germs program is a community health outreach program that focuses on the K-5 elementary schools of Alameda County, including preschools. The Owoc curriculum is based off of the Centers for Disease Control and Prevention, the CDC. We use 20-minute interactive classroom presentations that focus on the acronym WAC. The Owoc acronym is introduced to students by explaining that we can actually hit or whack germs by following these simple steps. Number 1, immunization for the eye. We can protect our families and ourselves by getting vaccinated. W, wash your hands. This is the number 1 most important thing we can do when there's no vaccine available. We have to properly wash our hands, and I'm going to demonstrate. There's 3 steps. First step, we need soap and warm water or hand sanitizer. With the students, we practice by giving them a squirt of hand sanitizer, and then we show them that we wash the inside, the outside, in between their fingers, their nails, and their wrists. All of these places are important because germs like to hide in the creases of our fingers. After that, the 3rd step would be how long do we rub and scrub for? It has to be 20 seconds at least. And for little kids, it's easy to remember the happy birthday song. If you sing it twice, it comes out to 20 seconds. So 20 seconds of rubbing the inside, outside, in between your fingers, your nails, and your wrists. H stands for home. Home is where you stay when you're sick. This can protect your friends and your family from spreading your illness to them. A stands for avoid touching your eyes, nose, and mouth. This is important because you have germs on your hands, and these germs can go inside your body through these openings and to make you sick. It can also cause illness to your friends by transferring your germs from your face to them by your hands. So we always use a tissue and throw it in the trash can. C stands for cover. Cover your coughs and sneezes. The proper way to cover is not with your hands because we use our hands for everything. So we should cover with our sleeve, and this is how it is recommended to completely cover your mouth and cough and sneeze into your sleeve. K stands for keep your distance from sick people. This is a social distancing tool that we teach students. The minimum distance should be 6 feet. And at 5 feet, if someone does not cover their sneeze, it could actually reach a person by airborne illnesses. So we show the students actually how far 6 feet is. The program is conducted in Spanish, English, and Chinese, Mandarin, or Cantonese. This school year, we have visited over 11 districts within Alameda County and educated over 10,000 students. The Owoc program is transferable to other organizations. It's very applicable to adults in healthcare settings or workplace settings. For more information, please visit our website at ACPHD.org and find the Owoc Germs program website there. Thank you.
The Alameda County Public Health Department works in partnership with its community-based organizations, faith-based communities, as well as government agencies and businesses to ensure the optimal health and well-being of all people in Alameda County. It also protects the public from public health threats through its immunization programs, disease investigation and tracking, as well as educating the public against public health threats. It also plays a critical role in emergency preparedness and response. Today we welcome Dominic Moreno from the Alameda County Public Health Department. He coordinates the Strategic National Stockpile Program. Welcome, Dominic.
Thank you.
So, Dominic, a lot of people don't know what the Strategic National Stockpile Program is. Tell us a little bit about it and how it helps to prepare the county to respond to emergencies.
Well, the Strategic National Stockpile, or the SNS program, is maintained by the CDC, the Center for Disease Control and Protection or Prevention, and the Department of Homeland Security. They maintain a large surplus of medication, medicines, as well as medical supplies that can be deployed out to the local health departments in the event of a large-scale public health emergency.
And now we did go through a large-scale emergency with H1N1 in the pandemic. And during that time, I know that there are thousands of vaccines were given out to people. You want to tell us how that was accomplished?
What we did here in Alameda County was opened up point of dispensing sites, what we call pods, which are large-scale facilities that can serve a lot of people, thousands of people per hour, to provide vaccine and or medication depending on the type of emergency.
And how much partnership does it take in order to get this accomplished?
We realized early on that the Alameda County Public Health Department needs to build and strengthen interagency partnerships with local cities as well as fire departments to meet the objective, which is to provide vaccine safely to the population of Alameda County. It's critical, these partnerships.
So we've gone through this event and things have slowed down a little bit. Now, how is the model being used to reach vulnerable populations?
We've taken mass dispensing in pods and scaled it down to a size that we believe can fit really into any facility. In fact, in January, we had the opportunity to test this model in the BART system. We took what would normally fit in a high school gymnasium or a community center and scaled it down to fit into the 12th Street BART station, and we vaccinated over 500 people.
Very good. And of all these sites that were done, were there any lessons learned throughout all of these events?
I think the biggest lesson that we learned as a department is that we can't do this alone. We need partnerships both at government level as well as private and commercial to assist in responding to a large-scale bioemergency.
So it sounds like a lot of work. Were there any new partnerships formed in doing this planning?
Well, like I mentioned, we had the opportunity to really reach out. Some of the non-traditional partnerships that we had the opportunity to build during H1N1 were with mass transportation systems. In fact, the partnership built with BART was one of the first in the nation that really provided mass prophylaxis or mass dispensing in a mass transportation system. We also have the opportunity to work with organizations like AC Transit, who are also another large-scale mass transportation provider for the Bay Area.
Now, some people may think it's a bit strange in terms of doing mass transportation. Is there any rationale as to why to go to mass transportation?
Absolutely. I think the number one is that in trying to figure out how best to reach some of our more vulnerable populations, we looked at where people were congregating already. The idea of bringing the medicine to them as opposed to trying to bring them to the medicine really made sense for us, and that's why we looked at the mass transportation systems in the Bay Area.
Well, thank you very much, Dominic. And there you have it, folks. This is how the Public Health Department is working to protect you during our public health emergencies.
Stop the violence. Out with hate, in with love. Every bullet shot is a tear shed.
This is the future of nonviolence. Students from the East Oakland Youth Development Center are bringing peace to each other, to their schools, and to their community.
Stop the violence, this is bad, you're making our community sad. Luckily for the EOYDC, it's a place to help our community. We always hear the story how East Oakland isn't cool, but we always fight back and say East Oakland is cool. Drop the guns so we can be tight.
Drop the guns so we can be tight.
Drop the guns so East Oakland can be right.
Drop the guns so East Oakland can be right.
The Alameda County Public Health Department joins the EOYDC in its efforts to reduce violence. Won't you join us too?
Stop the violence!
Welcome, and thank you for watching The Public's Health. A tradition of the Alameda County Public Health Department is to hold an annual staff meeting. The theme for this year's meeting was Public Health in the Spotlight, and we used the Academy Award ceremony as a model. We even held the event at a real movie theater. When our staff arrived out front of the movie theater, they walked on a red carpet to get inside and posed for pictures taken by our own paparazzi. Presenters during the ceremony addressed a variety of topics. Some shared information about the status of our department, some applauded our staff teamwork and encouraged us to continue, and others awarded contributions made by our community partners. Another feature of this year's event was unique. In keeping with the year's theme, each of our 6 divisions created a short movie about its role in the department. They were diverse and very creative. We think you'll also find them entertaining, and we'd like to share one of them with you now.
They took me. I can't remember. But it's not my fault. The aliens took me.
Poor Leslie. She only remembers her name. Her memory loss she blames on aliens. Do you think that maybe these photos will help restore her memory?
I don't know, Miriam. She's such a great employee in the nursing unit. This has got to work.
You are traveling in another division. A division not only of sight and sound, but one of heart. A division that is the middle ground between light and shadow, between caring and budgets. It lies between the pit of the county's resources and the summit of its ideals. This is the division of imagination we call the nursing zone.
Leslie, try to remember. The admin unit supports the nursing division. Don't you remember our esteemed leader, Dr. Relda Robertson Beckley, the Director of Public Health Nursing?
No, I can't. It's not my fault.
What about Region 1 staff at Eastmont Mall? Andrea, Deborah, the other nursing staff? They provide case management services, immunizations, community health services to families in northern Alameda County.
Community outreach services? No.
What about the Region 2 staff? Sonoria, Pam, Kimberly. They too provide case management services, immunizations, and community health outreach services to families in southern Alameda County.
Outreach services? I think.
The Pew Unit, under the direction of Serena, they provide pre-eligibility review services for all nursing referrals. What about the school-based unit, providing screening, case management, and technical support to OUSD schools?
Referrals, screening, technical support. Yes!
It's working!
Leslie, do you remember?
Yes, I remember! The nursing division!
No moral, no message, no prophetic tract. Just a simple statement of fact. For our community to survive, we all need to remember the important work of the nursing division. Tonight's very small exercise in logic from the nursing zone.
And joining us now from the nursing department is Angela Ball, who's here to tell us a little bit more about what was included in the movie. There were some words that were used like CHDP and others, and tell us about the nursing program here in Alameda County.
Well, the nursing program in Alameda County consists of public health nurses and community health outreach workers that work with the residents of Alameda County, who are involved in programs such as the CHDP program, as you mentioned, which is the Children's Health and Disability Prevention Program, and the Maternal, Child, and Adolescent Health Program as well. And they pretty much work with moms and babies in the community, new moms and their babies, as well as children in our communities. And we work very closely with a lot of the schools.
What kind of work do you do with schools?
Oh, with schools we have, we're embarking on this very large project with Madison Elementary School, where we're going to open up a school-based health center. And it's going to be staffed by nurses, nurse practitioners, some providers, and we're going to work with the students at the schools and their families, also with surrounding communities, because we know that access to health care is an issue in our communities, and we want to make sure that our families have access to health care.
Now, recently there was a big push around H1N1 vaccination. Did public health nursing participate in that?
Oh, yes, and the county had these large vaccination sites set up, and our nurses assisted with that. We had some community health outreach workers who also assisted, making sure that the applications were completed correctly, the consent forms, and then the nurses administered the vaccines to the families. Alameda County vaccinated the largest number of residents within the Bay Area, so it was quite a successful event.
And are those the only vaccines that public health nursing does?
No, we administer all the vaccinations that children receive, especially to get them into school. And we do administer some vaccinations to some adults, but most of our vaccinations are to young children.
Okay. And then I know that there's health fairs throughout the county. Tell me about your participation in
So
those.
our nurses participate in the health fairs. They conduct various health screenings like blood pressure screenings, cholesterol screenings, blood sugar testing. And then our community health outreach workers work with the individuals who participate or who attend the health fairs to connect them to resources or inform them of the resources that are available to them in the county.
Okay, and then one final question. Where do the nurses work?
Oh, we have several sites. We have one office in East Oakland at Eastmont Mall, and we have nurses and community health outreach workers who work out of that site. And we also have another office in Hayward around Amador and Winton Avenues near the county buildings, the county courthouse. And we also have a satellite office in downtown Oakland at 3600 Telegraph. And we also have a satellite clinic in Livermore, Pleasanton area as well.
So you cover the county?
Yes, we do. We
Okay.
do. We do.
Well, thank you very much.
Oh, thank you, Anita. Thank you.
I'm a senior citizen, and I'm definitely getting enough. Water, that is. To prevent dehydration, I drink 8 glasses of water a day. Fill her up, dear. Most of us need 6 to 8 glasses a day. Ask your nurse or doctor how much water is right for you. Make sure you are getting enough. Cheers.
Hi there, I'm Karen Owoc, and welcome to Karen About Your Health. Since 1960, childhood and teenage obesity has quadrupled, despite 50 years of expert advice to eat better and exercise more. In Alameda County today, 1/3 of our kids are now obese or overweight. With older kids and teenagers, the percentage is even higher. The health consequences of being overweight could include high cholesterol, high blood pressure, heart disease, and stroke. This is now true for children as well as adults. The type of diabetes that used to be called adult onset began to occur very frequently in children, and it is now called type 2 diabetes. It is now a problem for children, and our children are now becoming middle-aged. This rapid increase in childhood obesity, especially in low-income families, has alarmed public health agencies. Why has this been happening, and what can be done to improve the situation? Dietitians from our county's Child Health and Disability Prevention Program have some answers, and one of them is joining us today. She's here to tell us about a behavior change technique called brief focused advice. She trains pediatricians in this technique, and they use it to counsel their young patients. Please help me welcome Mary DeBusman to tell us more.
Hi, Karen.
Hi. Thank you for joining us today. What exactly is the brief focused advice technique?
Well, it's a technique to counsel anyone, really. It doesn't have to be children. But it's a counseling technique, and it's based on motivational interviewing. But it was developed by Kaiser Permanente to deliver behavior change messages in a short period of time.
What specifically does the doctor do to identify the problem and counsel the child?
Well, when a child sees a pediatrician, their height and weight are taken, and then BMI is calculated, and then they're put on a growth chart to see what percentile they're in. So when they identify an overweight or obese child, then the doctor can categorize them as being overweight or obese, and they can then dispense some behavior change techniques or advice to the family to try and get them to engage in either more physical activity, less TV, or some healthy eating habits like more fruits and vegetables.
So now the doctors have a limited time in these visits.
Right.
How long does this technique take?
The whole technique actually takes 3 minutes, and that was the point of trying to get the providers to engage in this, because they're very busy and they don't have a lot of time to spend with a technique like motivational interviewing, which can take quite a bit of time to go through the whole process.
What are the key elements, if you were to break it down, what are the key elements of the brief focus advice technique?
Sure. It has 4 steps. The first step is to engage the patient or parent. You ask them a question, something along the lines of, do you mind if we talk about your child's health today? And then the next step is share information. And as you were referring to before, a lot of these children who are overweight or obese are developing adult diseases like cardiovascular disease, diabetes, hypertension. So that's the opportunity for the provider to share this information with the family. And then the next step is to make a key advice statement. It could be something as simple as eliminating or decreasing the amount of fast food the family eats. And then the last step is to arrange for follow-up.
And I understand you have brought a crew of nurses with you to demonstrate the technique so we can actually see it in action.
Yes, we let them, during the training, they actually have an opportunity to practice the technique of brief focused advice, just to make them comfortable and demonstrate to them how the process can really be effective and short. It doesn't take a lot of time. We thought that if we got them to practice it, they'd be more likely to adopt the technique.
Right, just going through a role-playing skit.
Correct, it's a role-playing.
Great. What makes it effective?
What makes the technique effective is it is based on motivational interviewing. And motivational interviewing was actually developed about 20 years ago by a couple of psychiatrists, psychologists. And it was specifically at the time developed for addiction counseling. And instead of the provider dispensing information or telling patients what to do, it puts the patient in charge of their behavior. It lets them pick what they would like to work on and maybe come up with some ideas about how they will go about working on it.
So they become more proactive.
Completely. It puts them in charge of their behavior rather than having someone else telling them how to change their behavior.
And who can use this technique other than the doctors?
Well, in a provider's office, it could be a nurse practitioner, it could be a nurse, it could be anyone in the office who actually has contact with the children and the families and has a little bit of time to spend with them.
But do you think that the pediatricians have the most influence?
They do. There have been a lot of studies on that, and it, even though a lot of doctors will say my patients don't listen to me anyway. There has been a lot of research that has shown that if the doctor makes some kind of a statement, rather than just hand a family a brochure, if the doctor will talk to the family a little bit about what the brochure is about, the patients tend to find it more meaningful. They tend to remember it, and they actually tend to then share that information with their friends.
And as far as getting training, how does a physician or practitioner get training in this particular technique?
Well, this was developed by the Bay Area CHDP Nutrition Subcommittee, and it's available to anyone. It's actually on the state CHDP website. But it's helpful for whoever's interested to see the training one time, and I am happy. That's what my job is. I try and get people trained in the technique, and then hopefully they can train others.
I wish you the best of luck in training all these doctors, and we really have a serious problem with the overweight child these days, and it's great that you're doing this.
Great, thank you.
If you'd like more information on this technique, you can visit our website or give us a call. I'm Karen Owoc. Thank you for watching Caring About Your Health, and I'll see you next time. Here's your Caring About Your Health tip for today. Bananas, grapes, and apples, fresh or dried, make handy and nutritious snack items. Our producer, Albert, likes to remind himself to eat healthy by putting fruit where he can see it, whether he's writing, producing, or directing.
Ready and set, action.
Whatever works for you.
Thanks for watching The Public's Health. For more information, please visit our website or call the number on your screen. See you next time.